Hello, my name is Heather Hayes. I'm a physical therapist at the University of Utah. I'm working with the ALS Multidisciplinary Clinic, and today I would like to discuss with you home adaptations for patients with ALS. Oftentimes I get questions about how can I set up my home most efficiently and how can I make you safe. So my job is to work with you to identify what kind of concerns you may have in your home. My primary goals are to make you as safe as possible in your home and to help you along the way so that we don't end up with extra additional equipment that may not be necessary in the long run. So what do I need early on that I can continue to stay with me throughout the progression of this disease? The purpose of this presentation is to look at adaptations specifically to the bathroom. There are some other adaptations that can be done in the bedroom, but primarily I want to focus on the bathroom. As I take you through the series of potential equipment that may be beneficial to you, I want you to think about this as whether you have mild and early stage disease, moderate and middle stage disease, or late and more severe weakness. As I talk about this equipment, I want you to recognize that durable medical equipment includes terms such as wheelchairs, walkers, lift systems, and most of these are covered through insurance. However, the equipment items that I'm talking about today, such as rolling shower chair, bidet, raised toilet seat, are not covered through insurance. However, you can purchase and rent these items from your local vendor who you utilize for your durable medical equipment. What I'd like to do now is identify what I mean by somebody who has mild weakness versus moderate weakness versus severe weakness. When you think about this progression, we know that there are different ways that weakness may progress. And I don't want you to take this as your own category and what it is that you have to do at certain stages. There is a lot of variability in this disease progress. But if we think about mild weakness, what can I do to help protect you in those early stages when you may have some weakness? So mild weakness is an individual who is able to get through their normal activities. They may require some rest or adaptations. The individual will utilize energy conservation techniques and may look to ways to modify activities in order to perform their daily activities. These adaptations on the next slide will allow you to identify where you can save energy in places in your home without having to make huge sacrifice in your community activities. So my goal is to help you bridge the gap from that mild weakness into the moderate weakness so that you can continue to do those daily activities that you enjoy. Moderate weakness is individuals who may have more difficulty with some of their basic activities, bathing, dressing, eating, those things where the hands may become weaker or it's more difficult to stand up. You can still perform the activities, but they're not as easy as they used to be. And this is a time when these adaptive equipment will help you save some energy during your day. These may require walking aids to help decrease that fatigue. And so as I mentioned, these adaptive equipment, they're designed to help you not have to expend so much energy on something in the bathroom so that you can feel safe and comfortable in that environment. Severe weakness is an individual who maybe have difficulty with standing and performing these activities independently. They may need more assistance with dressing. They may need more assistance with their walker, maybe not be able to go as far using their assisted device. They may also need a wheelchair or be lifted onto the toilet or out of bed. So let's think about some bathroom additions that somebody may make if they have mild weakness. I'm going to show you several bathrooms that will help you work through some problem solving that may be a benefit in your own bathroom. Again, there's many variations on the theme, but these are some general ideas that can be used for individuals. Here's an example of a typical bathroom. It is a tub, shower, a toilet, and a sink. And when we think about this, it's a very small space. But there are things that we can do to make this a little bit safer for our individuals with mild weakness. We may want to put safety rails or grab bars in the bathroom. A very simple tool that most individuals like, whether you have mild, moderate, or severe weakness, is a bidet. I'm going to show you some examples of that. This helps with toileting hygiene and can be a benefit to both the patient as well as the caregivers. A raised toilet seat may be an option if you want to be a little bit more elevated rather than buying a new toilet, a handicapped toilet height. So I will show you some other options in the next slide so that you can see how this toilet can be adapted to make it more easier for you to maneuver in. So safety rails, there are many types of safety rails. These go around the toilet They can go under the toilet. They can go as a frame around the toilet. And these safety rails allow you to push up. If you need something that you feel like you need to pull versus pulling is easier, then you may want to have a flip down grab bar in front of you. Really depends on what mechanism is the best for you to transfer and maneuver. But these are also meant for safety for any sort of trunk weakness. Grab bars throughout the room would certainly be helpful. Consider the progression of the disease, again, if you're pulling or pushing, where you might want these. The grab bars on top that you see there are stainless steel and bolted in. That may not be something that you want to put into your room, but you certainly can. Often stepping into the bathtub might be a location. Also allowing you to use a grab bar to help you off your toilet may be an option. If you use the suction cup grab bars, these can be great because they can be maneuvered around the bathroom as you may need to be using the grab bars in different locations. Make sure that you get the suction cups that are large enough for you to go over the entire tile. These cannot be used on small tile where there's lots of junctions. You also do need to check these on a regular basis, but make sure you get a triple or larger suction cup, not a 1 inch, but you need to go to almost a 2 to 3 inches. Home Depots are not enough to allow you to get the large enough diameter that you need. Raised toilet seats. Anytime that we can make the toilet seat a little bit higher, but sometimes you may get too high and then you feel unsteady. So you can certainly go with a standard height toilet is 17 or a handicap toilet is 21 inches. We need to make sure that these toilets are able to have a rolling shower chair go over in the future. So consider this would be a temporary aid for you to use these raised toilet seats. You'll see many types there, with arms, without, frames around the toilet. Some go underneath the toilet to raise it up. So consider what type of device you may be considering in the future as I progress through this. Risers come from anywhere from 1 to 6 inches, and that can allow you to perch up a little bit taller. Bidet attachments, these are pretty much the number one thing that individuals like. It is not a separate system. It is an attachment that goes on your toilet. And it's just a button that allows you to take care of your hygiene. You do have to take care of drying if you feel like that is necessary. But this really helps individuals and caregivers if you have hand weakness, taking care of any sort of hygiene problems in toileting. There's also a spray wash system. If we look at the shower here, a couple of things that we always recommend early on is a removable shower head and height adjustable, so that you can actually, if you were to sit down, you would still have access to the shower head and being able to pull it down to help you with washing. This can help the caregiver as well if they need to take care of you. This would be a device that will stay with you over the course of the disease. It can be helpful. Again, grab bars in the shower may be helpful. You may also want a shower chair or a tub transfer bench. Those are two different types of devices, and I'm going to show you what those look like. You may want a tub rail rather than a grab bar to be able to help you step in. Those have different needs, but in the early stage, we're just protecting you to be able to do that step over into the shower, tub shower. Here's a removable shower head that can easily be bought and installed from Home Depot. Anybody can install this. You also have this tub rail that secures to the edge of the tub that lets you hold on to something to step in. But then we may consider something like a shower chair. Shower chairs should be able to adjust up to meet your height. They are easy to get wet. They have good stick into the shower base. Make sure you get one that fits your dimension. This is a great tool early on if you make it really tall in the shower and you have a removable shower head. If you needed to sit, standing in the shower can be quite exhausting, and this is a simple tool to help you rest and not be quite so tired having to stand in the shower, step over the shower, go get dressed. This is a tool that lets you just rest and not have to worry about that piece. A tub transfer bench really gets rid of that scary transfer as you're stepping into the tub. You can sit down on the outside and then slide across and put your feet into the tub by not having to stand. They make some that slide across so that somebody just has to lift your legs up and over. You can use these also in a shower, so we don't have to deal with that little lip in it. But if you can manage any of those lips, then you can use a shower chair, but a tub transfer bench acts as a bridge for you. Other adaptations in the bathroom may be something like an electric toothbrush to have to save some energy there, an electric razor to help save some energy, sponge on a stick so that you can reach your toes or your back more easily and not having to bend over. A high stool or a bar stool when you're brushing your teeth just to allow you to perch your bum if you have that early stage weakness and not have to stand during those activities. Flushable wet wipes instead of toilet paper may be another area to help you bridge the gap. And then a fluffy loofah for showering, because soap can be difficult to hold on to. So somebody could help prep that for you and have that ready to go so that you can wash your body. When I think about the moderate additions to weakness, there's only a few changes that may be made at this stage. The bathroom, the toileting itself would be the same, whether we use a raised toilet seat, a grab bar, toilet rail, safety rail. Those would all be the same at this stage in this disease. But there's some other stages if you really wanted to be able to get into your bathtub. And I mentioned the tub transfer bench, so I'm going to show you those again. So tub transfer benches, these can be used at this moderate weakness or even into more severe weakness. You can see that this has a little bit more, the one on the left has more mass to it and allows you to roll into the shower with it. And the one on the right allows more turning and inside the shower. So that might be, if you find that you're having more weakness in standing, these might be the next step that you want to do. So from a shower chair to a tub transfer bench. The reason why I mention these stages is that you may just want to not have to waste your money on a shower chair and go straight to a tub transfer bench. Or you may do a shower chair early on that doesn't cost much money and then use this as a bridge from moderate to severe weakness. The bathtub options, if somebody is really a fan of bathtubs, this is a bath lift that allows you to lower into the tub. So you could sit on the outside of the tub, slide in, go into the bathtub. Some of our patients really enjoy being able to get into a bathtub, and this may be an option. Keep in mind with severe weakness, we do have to make that transfer onto this device, but it may be money well spent for you to consider. So if we were to think about what you may want to do when mild to moderate weakness, that raised toilet seat, a bidet, grab bars, tub rail, tub transfer bench or shower chair, and a removable shower head. That would be kind of the simplest way to help adapt your bathroom.